Okay, you are excused. Let's go to our good friend Sasha O'Connell, if you'd come forward. And let's talk about the Idaho Health Data Exchange. Give us a little update there, please. And identify yourself for the record and then proceed.
Chairman Gross, Representative Horman, Madam Chair, members of the committee, I'm excited to be here today.
Why don't you put that mic a little closer to your mouth? There you go.
There we go.
Thank you.
Again, for the record, my name is Sasha O'Connell. I am now a Deputy Administrator with the Division of Medicaid in the Department of Health and Welfare. Last time I was here, I presented as a Principal Evaluator with the Legislature's Office of Performance Evaluations. So that's why I think I've been called back to chat about how the department has responded to some evaluation findings concerning the Idaho Health Data Exchange. So a little bit of background and a reminder for folks on the committee. The Idaho Health Data Exchange is an electronic exchange of health records between providers. So that's what we're going to be talking about today. And in August 2022, the Idaho Health Data Exchange filed for bankruptcy. That led to a March 2023 evaluation request by Speaker Moyle, Senator Groh, and Representatives Rubel, Cannon, and Pickett. That request went to the Joint Legislative Oversight Committee and then was directed to the Office of Performance Evaluations. In November 2023, OPE presented their findings to this committee, and I helped do that. So when we first started the evaluation, you'll remember that there was a lot of confusion about the Idaho Health Data Exchange. So I want to provide sort of a quick summary of OPE's findings. We found that the Idaho Health Data Exchange was created by the state as a nonprofit corporation without enough transparency and formal oversight. So you'll recall that the director of the Department of Health and Welfare signed articles of incorporation for the exchange, and the Health Quality Planning Commission in the department created the idea of developing this nonprofit corporation. We found that over time, the Idaho Health Data Exchange sort of drifted from the department's oversight. $24.4 million was paid to the exchange by Health and Welfare since 2008.
Sure, can I just comment on that? That was an interesting way you phrased that the Idaho Health Data Exchange kind of drifted away from oversight. It sounds like the oversight drifted away from doing their job, actually, right?
Yeah. Thank you, Chairman. And you'll remember the reason I frame it that way is because there was a lot of informal oversight at the beginning. Because the Health Quality Planning Commission created the exchange, it then turned into the board of this nonprofit corporation. The first director of the Idaho Health Data Exchange was a Department of Health and Welfare employee. So there was some informal oversight at the beginning. So that drift is what I'm referring to, because over time there was turnover as none of that was in statute. So $65 million was paid to healthcare providers to develop and exchange electronic health records, and part of those incentive payments were to connect to some sort of a health information exchange. We found that although the Department of Health and Welfare often talked about their data access agreement to see data on the Idaho Health Data Exchange, 95% of this funding went to create the Idaho Health Data Exchange and implement it. 5% was for that data access agreement, which was still in place at the time of the OPE report's release, and that data access agreement was $100,000 a year. Over the course of the Support Act contract, which we talked a lot about last November, we found that the Health Data Exchange was unable to connect as many providers as they had promised. So that was a significant shortcoming from the contract that they had with the Department of Health and Welfare. And another big issue that I talked with you all about was that the Department of Health and Welfare's IT experts were never able to confirm data security independently. There were federal standards that CMS, the Centers for Medicare and Medicaid Services, had put forward as required for the Idaho Health Data Exchange, and the IT experts at Health and Welfare were never able to confirm that security independently. Ultimately, there was a third-party attestation that you'll recall that the Health Data Exchange put forward as proof of data security, since the IT experts at Health and Welfare could not confirm it on their own. This was accepted by the Department of Health and Welfare, and then OPE found that it was not a third party, that there was a conflict of interest because the director of that organization was the Health Data Exchange's IT security officer. There were questions about the quality and completeness of work that was paid for over the course of this $20 million contract, but the Idaho Health Data Exchange still claimed that it was owed $1.5 million. Ultimately, the Department of Health and Welfare only paid the exchange $9 million out of that 20, and the rest of that was reverted to the federal government. But there was still kind of controversy with the exchange about them claiming that more was still owed. OPE also found that the Idaho Health Data Exchange was removed by the Department of Health and Welfare from this Support Act contract, but when OPE reviewed tax forms filed by the Health Data Exchange, it found that $2.2 million was still paid to the management consultants for the Idaho Health Data Exchange, despite being removed from that contract. Finally, OPE found that the Idaho Health Data Exchange filed for bankruptcy after being sued by a subcontractor for withholding pass-through payments from the Department of Health and Welfare. Ultimately, this civil lawsuit ended in a bankruptcy filing, and there was a payment plan for the Health Data Exchange to pay back 25% of the debts that it owed to this subcontractor and others, and those debts were to be repaid over the course of 5 years. So the exchange was still around, but under a bankruptcy plan when I reported to you all last November. So now I'm going to talk about the Department of Health and Welfare's response to this evaluation since I chatted with you all and since we presented those findings to the Joint Legislative Oversight Committee. So you'll recall that Director Cameron responded to OPE's evaluation during a Joint Legislative Oversight Committee meeting. Director Cameron had a unique perspective on this issue because of his time on JFAC, as well as his time just in the legislature more broadly when some of these ideas were being considered. He was surprised to find out about the independence that the exchange had and the issues with oversight. So the Department of Health and Welfare ended up sending a termination letter to the exchange in April 2024. And in that termination letter, it was sort of a conditional termination letter, if you will. And Director Cameron requested single financial audits that were reported by the exchange as being provided to the federal government, timekeeping records, as well as proof of independent data security audits. So this letter had a long list of items that if the exchange could provide some of those documents, the Department of Health and Welfare would consider not terminating the contract. In May 2024, the department received a response from the Idaho Health Data Exchange that was insufficient. And so the Division of Medicaid will not renew its data access agreement after it ends on June 30th. There's another key relationship with the Idaho Health Data Exchange, and that is the immunization database, which the Idaho Health Data Exchange still has access to. There is not a contract that oversees access to that immunization database, but the plans from the Division of Public Health are to also terminate access to that along the same timelines, so on June 30th. So the department has several considerations moving forward. I talked about in my presentation to you from OPE that there are a lot of options here. One that we need to talk about is the Department of Health and Welfare not having a contract with a health information exchange. So in this case, providers would continue to have any relationships with the exchange that they would like. The state does not have control at this point over the Idaho Health Data Exchange operating independently. The legislature could pass legislation around that area, but to date they are still operating and able to do so. So providers could continue to operate with them if they would like to. And they could also pursue other options with other health information exchanges. The Department of Health and Welfare could continue to encourage new HIEs to health information exchanges to come into Idaho. There are a couple of downsides to this. The Division of Public Health would need to make phone calls and faxes to get records for their infectious disease reporting, because that's what they use the Health Data Exchange for right now. They would also need to do the same for releasing medications that have special restrictions. The one that sticks in my head is the botulism antidote, which has a federal requirement associated with it. So the Division of Public Health goes into the Health Data Exchange to make sure that antidote is actually needed. From the Medicaid end of things, Medicaid already relies on providers to submit much of these records, and so that's true for our prior authorizations as well as our work to ensure appropriate billing. But one area that would be lacking without an exchange is that the department would need to work with its contractor to make more phone calls as it pertains to our case management. So this is a concern that has been raised by case managers. And that would be time-consuming on Medicaid staff and our contractor. Now, not having Health Data Exchange removes some of the potential of having a system that could support population health management as well. But I want to point out that that was never fully realized because participation in the exchange has been insufficient. But that still was a lofty goal of developing the exchange in the first place, and I think a meaningful one for many folks who still track this issue. Another option is that there could be another health information exchange. I've recommended that the state go through a procurement process if it was going to do that. You'll recall that there was a chapter in the evaluation that discussed challenges with the exchange having a sole source authorization for this contract. So if we were to pursue a new HIE, that should probably be through the procurement process. And there are a lot of options for that. There are existing HIEs in other states that might choose to bid on a RFP, a request for proposal that we put out. Or there could be a new health information exchange that could be created as well. And other states have pursued this option, including Alaska. I also want to talk about some important work that the legislature has done on this issue. You'll recall House Bill 708. That was brought forward last session. There was a lot going on, so I will remind you of what this pertained to. Representative Manwaring brought this bill. And you'll remember that one of the issues I talked about last session was that Article 8, Section 2 of the Constitution, for many people is quite clear that state agencies do not have the authority to create corporations. But there were some questions among state agencies about whether this applies to nonprofit corporations. So OPE recommended that to eliminate any question, the legislature could pass a law that more clearly prevents the state from creating corporations without legislative approval. And House Bill 708 did just that. It also requires reform of corporations that were created by the state, including the Idaho Health Data Exchange. So I want to talk about those provisions briefly. These corporations that were created by the state without legislative approval can request to become independent bodies, politic and corporate. That is the legislature's mechanism for creating an independent agency. Legislatures had that authority for a long time and did that for the Idaho Housing and Finance Association and several other entities. So these corporations can request to be converted to an independent body and ask the legislature for that. Or they can submit reports to the Secretary of State and the State Treasurer's Office by July 1st, 2025. Some of those reports are financial reports, as well as a copy of more recent bylaws, since the public does not have access to bylaws from nonprofit corporations, and a number of other reporting requirements. The final option is that these entities dissolve. The legislature will then decide on next steps with that list of corporations created by the state without legislative approval. So we will be waiting on your decision about what to do once you have that list in 2025 from the Secretary of State and the State Treasurer's Office. So with that, I'm happy to stand for any questions.
Representative Tanner.
Yeah, thank you, Mr. Chairman. Thank you. I appreciate you coming in here and gave us some really good information. I've had a lot of citizens actually have reached out with concern because they've reached out with some of them multiple times with letters even asking to get their data removed from the Idaho data or the Idaho Health Data Exchange, and they have not got a response back ever. So far, every person I've talked to that has actually attempted to try to do it has not been responded to. So, is there a way, or do we have to pass certain legislation to address this, or is there a way to actually for these people to get their data removed from that?
Go ahead and respond, please.
Mr. Chair, Representative Tanner, I have not heard of this concern before. I am aware that the Idaho Health Data Exchange has an opt-out form on its website. The OPE report links to that if anyone wishes to withdraw their data from the exchange. I do not know what the legislature's mechanisms of influence would be in this case. Yeah, I would need to follow up on that. But it's absolutely something that the legislature should be concerned about if people are not able to have their data removed from the exchange.
Other questions? I've got a couple, if I may. So we've spent millions, tens of millions on this, Idaho Health Data Exchange. What do we have right now as a result of the tens of millions that we've spent?
Thank you, Mr. Chair. We have a health data exchange that is used predominantly in rural areas that the state still relies on for ensuring that they don't need to make additional phone calls and receive faxes. I think that we still have a grand idea of what an exchange could look like, but the exchange did not live up to its full potential.
Follow up, if I may. So even though they're bankrupt, there's still something there?
Yes, it is still operating. The exchange is still operating, to my knowledge.
It raises the question, you probably don't have the answer, but who's paying for it? I mean, you know, the problem I see is the Idaho Health Data Exchange couldn't get enough providers that were interested in paying. And so it begs the next question. Under your slide number 5, it says, item number 2, potential procurement for new HIE vendor. Why would we want to go through this process again if the providers weren't willing to pay for it in the first place?
Chairman Groh, I think that the difference between what was listed on that slide and what was done is that going through the procurement process would involve the Department of Administration and would have an extra level of contract oversight because of that distance. The exchange never went through the procurement process. There were never any bids from people to say, you know, what they would be able to provide the state with an exchange. So the idea of going through procurement is wholly new.
And follow up then. So if you did go through a potential procurement process, what kind of money would we be talking about to try this thing again?
Thank you, Chairman Groh. I do not know. That's something that if the Department of Health and Welfare thought that it was necessary to go through that, there would probably be a request for information and consultation with other states. I know that the Deputy Director who's over the Division of Public Health has been having conversations with other states to find out more about that.
Thank you. I guess I'll make this statement for public record. Before the Department of Health and Welfare would go through this thing again, I would ask that before a dollar is spent, that the legislature be notified of what they're trying to do and that the legislature be involved in whether or not anything should happen. Another question, at the end of slide number 6, the legislature will then decide the next steps with the list of corporations created by the state without legislative approval. Who's going to provide that list and to whom would it be provided?
Thank you, Chairman Grow. That's a great question. I know that the list is coming from the Secretary of State and the State Treasurer's Office. I don't recall if it's being delivered to legislative leadership or where exactly it is being delivered within the legislature. But House Bill 708 says that very clearly. I just don't know off the top of my head.
Okay, thank you. I guess for our minutes for this meeting, Mr. Bybee, I would hope that we would note this item in particular and get some kind of follow-up as to what would be happening here, who would provide that, and to whom, et cetera. Could we get that in our minutes? Thank you. Anything else for Ms. O'Connell? Oh, go ahead, please.
One follow-up to your previous question.
Sure.
You asked who is paying for the operating expenses of the exchange right now, and I'll remind you that they are under a bankruptcy plan, so a significant share of their debt is not being paid for. They are only paying for 25% of the expenses that were owed. So I feel like that's important context.
Sounds kind of like a dead-end street to me. Go ahead. Co-chair.
Thank you, Mr. Co-chair. I just pulled up the bill. It looks like those will be reported to the Secretary of State, who shall deliver the report to the Governor, the Pro Tem, and the Speaker of the House.
Thank you. Appreciate that information. Other questions or comments? Ms. O'Connell, we miss you in OPE, but we're glad you are, because we will see you there.
Thank you. It's nice to be here.
Thank you for coming to make that presentation today.